everyone, my name is Dina, and I want to welcome you to the first in my Childbirth Chat series. We are going to be discussing all things related to childbirth. To give you a little bit about my background, I spent 25 years as a maternity nurse. I worked in labor and delivery, in the mother-baby unit, as an OB clinical instructor to new nursing students, and as a certified childbirth educator, teaching childbirth classes to expectant couples. I want to congratulate all of you on this amazing journey that you are about to embark on. One of the first things I would like to discuss is how do you know when labor begins? Only about 5% of women actually deliver on their due date. Labor can begin anytime between 37 and 42 weeks of pregnancy. When labor starts, you will feel contractions. Early contractions are usually felt as either period cramps, lower abdominal pressure, your uterus may feel tight and then relax or get hard and then soft, or you may feel pressure in your lower back. Contractions usually start out in what we call an irregular pattern. What that means is there is no real consistency to when they come. You may have one contraction, 6 minutes later have another, have one 10 minutes after that, and then have another 2 minutes later. There is no set pattern yet, and we call these irregular contractions. How you time contractions is the start of one contraction to the start of the next one. Once the contractions start to come with some consistency, you will need to record how often they are coming, which is the frequency. Another thing that you will have to note is how long they are lasting for, which is the duration. Early labor contractions may only last 20 to 30 seconds each, with that time getting longer as your labor progresses. How you know how long they are lasting for is you note the start of a contraction to the end of that same contraction. Most healthcare providers recommend that first-time moms call them when their contractions are about 5 minutes apart, lasting for at least a minute each, for at least an hour. If your doctor tells you something else, always follow the instructions of your doctor. The reason that we ask you to wait until your contractions have a pattern is because you may not be in what we refer to as true labor, but may be experiencing false labor. False labor contractions are also known as warm-up contractions. They may develop somewhat of a pattern, but they do not cause your cervix to dilate or open, and they usually ease up over time. If you go to the hospital too soon, it is often difficult to distinguish whether you are in false labor or the beginning stages of true labor. There are several other reasons to call your doctor, and one of them being if your water breaks, even if you are having no contractions. Only about 10% of women break their water before labor begins. Breaking your water, also known as spontaneous rupture of membranes, may be very obvious and feel like a gush of fluid comes out, or may not be so obvious and you may just feel a little trickle of fluid. If you are unsure if your water has broken, call your doctor anyway. The amniotic sac protects your baby from infection. And if your water breaks, we like to have your baby delivered within about 24 hours. If you are unsure, please call your doctor so that it can be determined if it is amniotic fluid that is leaking. The fluid should be clear or pink tinged. If it is greenish or brownish in color, it may mean that your baby had a bowel movement in your uterus called meconium. Please let your doctor know the color of the fluid, when your water breaks, and what time it happened. And do not hesitate to call immediately if there is meconium. It is also really important to call your provider if you have any vaginal bleeding. If you recently had sexual intercourse or a vaginal exam, you may see some light pink tinge on the toilet paper after you use the bathroom. If you have bright red vaginal bleeding, like a period, please notify your doctor right away. Some other warning signs to call for are a fever above 100 degrees, visual disturbances or headaches, decreased fetal movement, sudden severe contractions, sudden swelling in your face or your hands, or painful urination. If you are less than 37 weeks pregnant and experience 4 or more contractions in 1 hour, change in vaginal discharge, or leakage of fluid, please call your doctor right away because you may be experiencing preterm labor. If you are having preterm labor, your doctor may want to give you IV fluids or medication to stop your contractions until you reach 37 weeks and it is safer for the baby to come out. Now that we have determined how to distinguish the start of labor, what are some things that you can do to help with any discomfort? First, it is important to know that labor is a natural process, and your body knows exactly what it is supposed to do. It is okay to be scared of the unknown. Most people are. The more educated that you become in the labor process, the less scary it will become for you. There is a cycle of pain known as the fear, tension, pain cycle. When you experience fear, your muscles tend to tense up due to this fear. When your muscles tense up, they get less oxygen, which then causes the pain to feel worse. The increased pain causes more fear causes more tension, and more tension causes more pain. What you need to do is break this cycle, and there are several ways to do it. The key is becoming more relaxed during labor. And here are some examples of ways to help your body to relax. You can use patterned breathing, which we will review this during another video. You can use massage and touch therapy. You can take a shower or a bath. You can use guided imagery exercises where you imagine yourself in a comfortable, positive scenario. My favorite place to use is the beach in Hawaii. You can frequently change your body positions. You can use a focal point as a distraction. And support from your birth partner. This is the one that I find most useful. Supportive words, encouragement, compliments, and patience are more important than you could possibly know. Knowing what to expect during labor really does help decrease this fear of the unknown. As a labor nurse, I can walk into my patient's room and tell within the first few minutes if my patient took childbirth classes. It really does make a difference in more ways than you can possibly imagine. Most hospitals let you have several coaches present in your room during your labor and delivery. Please choose wisely when deciding on who will be with you during this time. Make sure that the people you choose are there to support you physically and emotionally. Their job is to offer support and encouragement, give you back rubs, help you breathe through your contractions, get you ice chips or wet washcloths, and be there to nurture you every step of the way. This is one of the most special events of your life, and who you choose to participate in this day can have a positive or a negative impact. During my first labor, I thought it would be great to have my mom there for the birth of her grandson. I found myself comforting my mom during my contractions because she had a difficult time seeing her daughter in pain. For my second labor, it was just my husband and I, and that was a much better fit. You should discuss this with your partner and figure out what is the best option for you. It's important to understand the process of labor so that you know what is going on with your body and what that means. The average first-time labor is approximately 14 to 24 hours. It can be shorter and it can be longer. The purpose of labor pains is to assist your cervix to open up or dilate so that the baby can be safely pushed out of the birth canal and into the world. You will hear certain terms when your doctor, midwife, or nurse checks your cervix with the vaginal exam. You will hear the words dilation, effacement, and station. I want to discuss what each of these terms mean so that you can understand the progress of labor. Dilation is the opening of your cervix. Your cervix starts out as closed, and as labor progresses, your cervix opens up to 10 centimeters, also known as fully or completely dilated. In addition to your cervix opening up, it also needs to thin out. This is called cervical effacement, and it is measured as a percentage. When your cervix is not yet effaced, it is considered thick and is like a long bottleneck and is approximately 4 centimeters in length or thickness. As your labor progresses, your cervix will continue to thin out or efface. When your cervix is completely effaced or 100%, it is paper thin. A third thing that is checked during a vaginal exam is called station. This is a way to measure how high or how low your baby's head is in your pelvis. It is measured by the relationship of your baby's head to the bones in your pelvis known as the ischial spines. If the baby is at the level of the ischial spines, your baby is considered at a 0 station. If your baby is a centimeter above this, your baby is considered a -1 station. 2 centimeters above this is a -2. 3 centimeters above is a -3 station. If your baby gets lower in your pelvis into your birth canal, your baby station is measured in pluses. A centimeter below the ischial spines down towards your vaginal opening is a +1. 2 centimeters below is a +2. 3 centimeters below is a +3. You are getting ready to deliver when your baby is about a +4 to a +5 station. When labor is beginning, you may hear your doctor say, as an example, that you are 1 centimeter dilated, 50% effaced, and a -3 station. As you move into a more active phase of labor, you may hear your doctor say something like you are a 6 centimeters dilated, 90% effaced, and at a 0 station. Understanding these terms helps you to better understand your labor progress. Labor is divided into stages. The first stage of labor is from the start of cervical dilation until you become fully dilated and ready to push. The second stage of labor is from when you start pushing until your baby is delivered. The third stage of labor is the delivery of your placenta, and the fourth stage of labor is your recovery period and lasts for the first few hours after birth. The first stage of labor is further divided into 3 phases. The first phase is the early or latent phase of labor, and for first-time moms, usually lasts approximately 6 to 12 hours or may last even longer. Your contractions will likely start out in an irregular pattern and get more consistent as your labor goes on. During early labor, your cervix is dilated between 0 and 3 centimeters. You may spend most of your early labor at home. Try to rest, stay well hydrated, keep your bladder empty, eat lightly, and do whatever activities keep you comfortable, such as going for a walk or taking a shower. Make sure to keep your doctor or midwife aware of what is going on, and they will tell you when to make your way to the hospital. While at the hospital, the staff will place you on a fetal monitor. This will assess your baby's heartbeat and the frequency and duration of your contractions. If the monitor shows that your baby is responding well to your labor, your healthcare provider may allow the nurses to place you on the monitor only intermittently during your labor. The next phase of labor is called the active phase. And for first-time moms, this usually lasts about 3 to 5 hours or more, and your cervix is dilated between 4 and 7 centimeters. Your contractions are stronger, they last longer, and have a regular pattern. You may have spots of bleeding, known as bloody show, during this phase. You will be utilizing the techniques discussed earlier in the video, such as breathing and relaxation techniques, guided imagery, and use of a focal point. Your hospital may offer you the use of a Whirlpool jet tub. If your healthcare provider gives the okay for this, I highly recommend it. I will never forget the patient that I had one time when I came into a 12-hour shift. She was in bed and she was very insistent that she wanted to spend her labor there. I recommended using the Whirlpool tub and she absolutely refused, stating to me that she just wanted to stay in bed. And I made a deal with her. I told her to give me 10 minutes, just 10 minutes in the Whirlpool jet tub. And if she decided she did not like it, I would get her back in bed and I would let her spend the rest of her labor there. Well, once I got her into the tub and got her comfortable, I could not get her out. She wanted to spend her entire labor there, and she was so grateful for me for giving her that idea and making her labor so much better than it was when she was left in bed. Another option is a birthing ball. This is a large air-filled ball similar to an exercise ball that you find in a gym and that a woman can use during labor. You can sit on the ball and rock back and forth or gently bounce during contractions. This may help to ease back labor, help the baby get into a better position by opening up your pelvis, and may reduce discomfort and anxiety. You may choose to get up and walk around, use the shower, or sit in a rocking chair. If you decide that you want pain medication or an epidural, the active phase of labor is a good time to have this discussion with your doctor. We will discuss pain relief options in labor and delivery during another video. The last phase of labor is called transition. This is the most difficult phase of labor, but it is also the shortest, usually only lasting between 1/2 to 2 hours. During this phase, your cervix dilates from 8 centimeters to 10 centimeters or fully dilated. You may also have chills, shaking, nausea, and increasing pressure. I refer to transition as an emotional roller coaster. Your behavior may go back and forth between emotions, and you may not know what to do. Many women may say things like, "I can't do this" during transition. It is so important that their birthing partner read their cues and be vigilant in the supportive efforts. Once transition is completed and the woman becomes 10 centimeters dilated, it is time to push and begin the second stage of labor. The average pushing time for first-time moms is usually between 1 to 2 hours. Contractions during pushing are usually less intense than they were during transition. You may feel the urge to bear down or may have pressure in your rectum like you need to have a bowel movement. Your nurse will coach you through pushing and be there to support you along with your partner or support person. As your contraction starts, your nurse will have you take 2 big breaths in and out as your contraction is building in strength, and it will look something like this. As you take that third big breath in, your nurse will have you place your hands underneath your thighs to pull back your legs and open up your pelvis. And she and your coach will hold your feet for support. You will then bear down long and steady into your bottom. As you bear down, you can make grunting noises, slowly let the air out, or make hissing sounds, whichever is the most comfortable for you. You want to push down in your bottom for as long as you can. When you need to take a breath, you will take a deep breath and repeat the process. You want to have 3 long, steady pushes down to your bottom for each contraction. When the contraction is over, you will take a cleansing breath and you will relax. Put your legs back down on the bed, close your eyes, put a wet washcloth on your face or suck an ice chip. You want to make sure that you rest as much as possible between contractions so that you save energy for the next one. You do not have to push in just one position, but you can change positions with the help of your nurse if you feel more comfortable in a different position or if the baby is not moving down toward your birth canal in your current position. You can push side lying, sitting up, on all fours, or you can even use a squatting bar with assistance. When your baby's head is far down in your pelvis, where it stays at the vaginal opening and no longer slides back up, your doctor or midwife will start preparing for your delivery. They will put on a sterile gown and sterile gloves. They may or may not put your legs up in stirrups, and they will get all of the equipment ready to deliver your baby safely. Once your baby's head is out, they will have you stop pushing. They will use something called a bulb syringe to suction out mucus or amniotic fluid from your baby's mouth and nose so that when your baby gives us that first big cry, your baby will have a clear airway. As you have the next contraction, They will deliver the shoulders, and then the rest of the baby will slide out. They consider the time of birth when the entire baby's body is out. The doctor or midwife will then dry your baby off with a warm towel, and this serves two purposes. First, your baby is used to being in 98.6 nice warm amniotic fluid and is now being delivered into a colder delivery room and is wet. Drying your baby off helps to get your baby warm, and it also stimulates your baby to give us that first nice big cry so that your baby can get that oxygen into his or her lungs. Now, when your babies are first delivered, do not expect them to be pink and crying. They are usually a bluish color when they first come out. When they start crying, they usually pink up pretty quickly. The doctor will place your baby on your bare chest, and by doing skin to skin, that helps to regulate the baby's temperature, breathing, and blood sugar levels, and is a great way to start the bonding process. Your nurse will then place warm blankets on top of your baby. The doctor will place 2 clamps on the umbilical cord, and if your partner wants to cut the cord, the doctor will hand over the scissors, and the cord can be cut between the 2 clamps. If your baby is doing well, your nurse will leave her on your chest while the doctor or midwife delivers your placenta. The placenta is usually delivered about 5 to 20 minutes after the birth of your baby. You will probably just feel a slight contraction, and along with the gentle pull of the cord, your placenta should be easily delivered. Now your 3rd stage of labor is completed. Your nurse will fill out 4 identification bracelets, all with matching numbers and information, and will put 2 of them on your baby's ankles, 1 on your wrist, and 1 on your support person's wrist. They will also weigh the baby in the delivery room, take your baby's vital signs, and wrap your baby up in nice warm blankets to keep her warm. These will be the most exhilarating moments of your life. You just brought life into the world, and there really are no words to describe how many emotions you will be feeling. You will be feeling pure joy while simultaneously feeling utter exhaustion. I had the honor and the privilege to be present in thousands of births, and I can tell you it really, truly is a miracle. This is the end and the first of my series. I hope that you will follow along with my future videos. Topics that I would like to discuss are breathing and relaxation techniques during labor, pain management during labor and delivery, what to expect if you need to have a C-section, postpartum care in the hospital and at home, and infant care. I hope that you will follow along. Please like, share, and subscribe, and I wish you nothing but the best in your labor and delivery, and congratulations again. Thank you.